Most neuropathy patients I see know they have nerve damage. What most of them don't know is that there's a specific progression pattern, and most people miss the warning signs until a stage or two has already passed. Today, I'm going to give you the 7 signs I actually look for in clinic when a patient's neuropathy is advancing. Some of these will surprise you because a few of them have nothing to do with pain. After 35 years in practice, with the last several years dedicated entirely to patients with peripheral neuropathy, I've seen what progression looks like across thousands of cases, and I can tell you that there is a pattern. The problem is that most patients are never shown what that pattern looks like. They're told their condition is progressive, handed a prescription, and sent home without a single specific thing to watch for. That changes today. I'm going to give you the 7 clinical signs I actually use, the ones I'm looking for when a patient comes in and something has shifted. Some of these involve pain, some don't. The ones that don't involve pain are honestly the ones I take most seriously. And I'll tell you which signs need action right now and which ones need to be on your tracking list. Before we get started into the 7 signs, I want to give you a fast piece of context that most people with neuropathy have never been given. When people think about their neuropathy, if it's getting worse, they almost always think more pain, more burning, more tingling. That's the natural assumption, but that's not actually how neuropathy progresses. Neuropathy advances along a very specific biological pathway. It starts with the sensory nerves. That's the burning, that's the tingling, that's the numbness. Then it moves into proprioceptive fibers. Those are the nerves that tell your brain where your feet are in space. Then in more advanced cases, it can involve the autonomic nerves, the ones that regulate things like temperature, sweating, and circulation. And in the most advanced presentations, the motor fibers get pulled in. That's when you start to see the weakness. Each of those stages has distinct warning signs. Some of them, the most important ones, have nothing to do with how much pain you're in. That's why this list actually matters, because knowing where you are on that pathway changes the conversation that you need to be having with your provider. Let's go through all 7 signs. Sign number 1, numbness spreading above the ankle. The first sign and the clearest single marker of progression is numbness that is spreading upward. Here's the biology. Peripheral neuropathy is what we call length or distance dependent. It attacks the longest nerves first. That's why it always starts in the feet and toes. Those are served by the longest nerve fibers and are also the farthest place away from the heart in terms of circulation. As it advances, the damage moves proximally, which means it just moves upward toward the body. The sole of the foot first, then the top of the foot, then above the ankle, then towards the knee. This pattern has a name. We call it stocking distribution because it flows like the shape of a stocking on your leg. Now, some numbness in the feet is expected with neuropathy. What I'm watching for is change. If you had numbness only in your toes 2 years ago and now it's consistently above your ankle, that's not fluctuation. That, unfortunately, is progression. The rate of spread matters too. Numbness that has crept upward slowly over several years is a different clinical picture than numbness that has just moved significantly in a matter of weeks or months. Fast progression warrants a more urgent evaluation. If the numbness in your feet has climbed above your ankle, write that down. That's sign number 1. And it's the most important single marker I know of for confirmed progression. Sign 2, pain shifting from episodic to constant. The second sign is a shift in the character of your pain, not just how intense it is, but whether it ever fully turns off. Early neuropathy is typically episodic. You have burning, tingling, sharp sensations. They come and go. You might have stretches of relative relief, pain-free windows, or Even in a short time, it seems like it's gone. As neuropathy progresses, though, something changes. The pain stops being episodic and becomes a background constant. It's always there. It might vary in intensity throughout the day, but it never fully switches off. That shift from pain that comes and goes to pain that's just always there is a clinical sign. What it indicates that central sensitization has started to develop. That's a process where the brain and its pain processing system begins to be rewired by the chronic input it seems to be receiving from the damaged nerves. The volume dial, so to speak, gets stuck at a higher setting. Now, this is a sign that patients often underreport because they adapt to it. They stop noticing the absence of pain-free windows and they just accept this baseline as normal. So ask yourself honestly, do you have pain-free windows the way you used to? Or has there been a slow drift towards something that's just always there? If those windows are shrinking or gone, that is worth flagging. Sign number 3, balance or walking changes. Sign 3 is the one that surprises people the most. And it's the one I want you to pay close attention to because it carries a real safety implication. Your nervous system has a function called proprioception. It's the ability to sense where your body is in space, specifically where your feet are relative to the ground beneath you. Every step you take, your nervous system is receiving and processing that information constantly. When proprioceptive nerve fibers are affected by neuropathy, your brain can no longer accurately track your foot position, and the result isn't more pain. The result is instability. Here's what that looks like in practice. A shuffle when you walk, especially on uneven ground. Needing to look down all the time at your feet to feel confident on stairs or a curb. Reaching for a wall or countertop more than you used to. Near falls, the ones where you catch yourself and just in time. Here's the important thing about this sign. It exists completely independently of pain severity. I've seen patients with relatively mild pain who have significant balance impairment, and I've seen patients in significant pain and discomfort who have very stable gaits. Pain level does not tell me balance status. They are separate measurements. This matters because falls at this stage and this age group are not minor events. A fall-related injury can set someone back months or longer or permanently. If your balance or gait has changed, even if your pain hasn't gotten dramatically worse, that is a specialist level finding, not a watch and wait situation. Sign 3, balance and walking changes. Track it. And if it's worsening, don't wait. Before we get to what I call the danger zone signs 4 and 5, if you're finding this useful, go ahead and subscribe. Every video I put out on this channel goes into this level of clinical depth. And the next video in this neuropathy series is one you do not want to miss. Sign 4, wounds that don't hurt or don't heal. Signs 4 and 5 are what I call the danger zone signs. These are the ones that tell me a patient's neuropathy has crossed into territory where medical risk profile actually changes. Sign 4 is wounds that don't hurt or wounds that don't heal. There's a term in clinical neuropathy care, loss of protective sensation, or LPS. It refers to the point where they can no longer reliably feel when the foot is injured. A blister forming, a small cut, a pressure sore from footwear. The alarm system is essentially gone. Here's why this is dangerous. Normally, pain is protective. If you step on something, it hurts, and the pain triggers you to look to care for the wound and to protect it. When that signal is absent, though, a small wound starts without your awareness. It gets contaminated and progresses because there's no signaling telling you to address it. For patients with diabetes, this is the mechanism behind neuropathic foot ulcers, one of the most serious and preventable complications of diabetic neuropathy. But this is not just diabetic neuropathy issues. Any patient with advanced sensory loss is at risk. The signs for you to watch for: wounds you don't notice forming until they're already significant, blisters that got large before you saw them, calluses or pressure areas that appeared without your awareness. What I tell every patient with significant neuropathy: daily foot inspections every day, both feet, all surfaces, including between the toes. This is standard clinical guidance that, I'll be honest, a lot of patients have never been given. If wounds are forming without your awareness, or if a wound is not healing on a normal timeline, that is a medical conversation that needs to happen now. Sign 5, loss of temperature sensation. Sign 5 is one that often gets grouped in with general numbness, but it's actually a very distinct and important warning sign. I want to separate it out right now. The ability to detect temperature, to tell whether something is hot or cold, is carried by a specific class of small nerve fibers called C fibers and A delta fibers. These are among the first fibers affected in small fiber neuropathy, and they're also affected early in diabetic neuropathy. Here's the test. Can you tell with reasonable certainty whether the water in your shower or bath is hot or cold by feel in your feet? If that distinction has become unclear or absent, that is temperature sensation loss. The risk is direct. Patients with temperature sensation loss have been burned by heating pads applied to the feet, scalded in bathtubs. The tissue damage happens before any discomfort registers because the warning system isn't functioning. Walking on hot pavement or sand in the summertime, another one. The sign often appears earlier than people expect. It can precede significant visible numbness, which means if temperature sensation has changed in your feet, that's a finding worth bringing to a specialist, even if your other symptoms haven't dramatically worsened. I'll mention, if you're curious about small fiber neuropathy specifically, I did a dedicated video on that condition. It's one where a normal EMG comes back clean, and patients are often told nothing is wrong, when in fact there absolutely is. Sign 5 connects directly to that. I'll link it in the outro. Sign 6, worsening sleep disruption, specifically from pain. Sign 6 is not just bad sleep. Most people with neuropathy have some sleep disruption. What I'm watching for here is a specific pattern: nighttime pain or discomfort that is intensifying despite a stable treatment plan. There's a reason neuropathy pain tends to be worse at night. Your body's hormonal patterns during sleep shift in ways that amplify pain perception. It's a real phenomenon. Also, you're not distracted by the events of the day, which also brings us more to awareness. I covered the full mechanism in the burning feet at night video, and I'll link that as well. What matters here is tracking change. Were you waking up twice a week from pain a year ago? Are you now waking up every single night? Has the intensity when you do wake up increased, even though your medication hasn't changed? That kind of measurable deterioration at nighttime symptoms is a progression signal. It tells me the condition is advancing faster than the current treatment protocol is able to manage it. The other piece of this sign that's worth understanding: disrupted sleep isn't just an inconvenience for someone. Sleep is when your body's repair process runs. Consistently disrupted sleep interferes with those cycles, which can in turn affect your ability of how you're healing, how effectively the nervous system can manage inflammation and work towards recovery. If nighttime pain specifically has gotten significantly worse over the past several months, that's a sign your treatment protocol needs to be reevaluated. Not adjusted slightly, reevaluated. Sign 7, weakness or foot drop. Sign 7 is the one that tells me nerve damage has moved into new territory. Most neuropathy, especially in its earlier stages, is sensory: burning, tingling, numbness. The motor system, which controls movement and strength, is relatively spared at that start. When motor fibers get involved, the presentation changes. You'll notice things like difficulty lifting the front of your foot when you walk. That's called foot drop. And if it's often subtle at first, catching your toe on the flat ground when there's nothing actually there to catch it on, a slightly heavier footfall on one side, weakness in the ankle when climbing stairs or stepping off a curb. Foot drop in particular often starts as an occasional a trip here, a stumble there, and patients write it off. I just wasn't paying attention. But when it's happening with any regularity on flat ground, that's not inattention. That's motor fiber involvement. This is a meaningful clinical transition point. Motor neuropathy requires an evaluation approach that's different from sensory-only management. The nerve damage has broadened its footprint. It's no longer confined to the sensory nerve fibers. If you've noticed any weakness in your feet, any difficulty lifting the leg or foot when you walk, or any change in foot control, that is a conversation that needs to happen with a neuropathy specialist. 7 signs. Let me give you them in a fast summary. 1. Numbness spreading above the ankle. 2. Pain shifting from episodic to constant. 3. Balance or walking changes. 4. Wounds that don't hurt or don't heal. 5. Loss of temperature sensation. 6. Nighttime pain worsening despite stable treatment. 7. Weakness or foot drop. Here is how I want you to use this list. This is not a reason to panic. Most of these signs, when caught at the stage or early where you're watching for them, are more manageable. The purpose of knowing them is exactly this. Earlier identification means earlier conversation, and earlier conversation means more options. What I encourage you to notice is the pattern across these 7. One sign by itself may mean different things depending on the person. If you've identified 3 or more of these, if you've got spreading numbness, some balance changes, and your nighttime pain or discomfort has been climbing, that pattern is telling you something. That pattern deserves a specialist evaluation, not a primary care follow-up where neuropathy is a one item on a 15-minute appointment. An evaluation with someone whose entire clinical focus is the condition you're actually dealing with. The most dangerous sign on this list are not the ones that hurt the most. They're the ones that involve loss of sensation, loss of balance, and wounds forming without awareness. Those are the ones that can lead to falls and serious injuries before a person realizes how far the progression has actually gone. If temperature sensation has changed, if wounds aren't healing, or if any weakness has appeared in your feet, those are findings that warrant action, not observation. If sign 5, the temperature sensation lost, felt familiar to you, I did a full video on small fiber neuropathy. The kind where normal EMG comes back clean, doctors tell you nothing is wrong, and you know something absolutely is wrong. That video goes into exactly why that happens and what a proper evaluation looks like. I'll link it here. And if you want to understand why most neuropathy treatments, even with a good doctor, stop short of addressing the kind of progression we talked about today, the Why Most Neuropathy Treatments Fail video covers that in depth. If you're new to this channel, this is what every video here looks like. Clinical depth, no fluff. Subscribe if that's useful to you. And one question for the comments: which of these 7 signs have you noticed? Drop a number or a few numbers below. I read them. It helps me understand what to cover next.